are you today?
Pretty good. How are you?
Good, thank you. I'm Abby. I'm going to be your student nurse for today, and we're going to just do an assessment on your peripheral vascular system.
Okay.
Okay? And so first I'm going to start out with your heart, all right?
Okay.
I'm going to feel for your apical pulse and listen to it for a full minute.
Okay.
And she's looking for the apical pulse, which is going to be located at the 4th or the 5th intercostal space on the left side near the mid-clavicular line. And you have to decide if it's 4th or 5th. It can't be, you can't just say 4th or 5th. You have to designate which place.
I found hers at the 5th intercostal space. That was a full minute. Okay, the second thing I'm going to do is take a good listen to your heart.
Okay.
And I'm going to do it 2 times through, because the first time I'm going to do it with my diaphragm,
Okay.
and then the second time is with the bell, and that listens for heart murmurs.
Okay.
Okay.
You can remember your A2 man mnemonic that will be posted in the course, but she's starting with the aortic area over the right second inner space, then moving to pulmonic over the left intercostal space. Then Erb's point is at the 3rd intercostal space at the sternal border, left sternal border. Tricuspid at the 4th left inner space. Then at the mitral area, which is at the 5th inner space on the left mid-clavicular line. Next, she will do the exam with the bell, listening for bruits.
Okay, everything sounds really good. Okay, and then I'm going to listen to your stomach.
Okay.
Listen to your bowel sounds and your renal arteries for bruits.
Okay.
Okay, I'm going to lay you back down if that's okay.
Okay.
And then to relax your abdominal muscles, I'm going to ask you to either bend your knees if you're comfortable, or I can get you some pillows.
Okay, I'll just bend them.
Is that okay?
Yeah.
Perfect. Okay, and I'm going to have to expose your abdomen.
Okay. So ticklish.
Are you comfortable?
Yes.
Okay. So I'm going to listen. Before I listen, guess we can get that.
That's okay.
Before I listen, I'm going to observe your stomach.
Okay.
So I'm looking for pulsations. I don't see any pulsations. I'm going to look and see the shape of her stomach.
And here she would describe if the abdomen is scaphoid or rounded. She will also look for any lesions on the skin, and sometimes you will find a piercing in the belly button. And if you do, you want to make sure there's no signs of infection at that piercing.
I see a scaphoid abdomen, and I do not see any marks or lesions, and no belly button piercings.
She's also going to look at the umbilicus to see if it is inverted or everted.
It is inverted. Maybe a little bit of both. Okay, now I'm going to take a listen.
Okay.
And I'm first going to do this with my diaphragm.
Okay.
So I'm going to listen to your right lower quadrant, and then the right upper quadrant, the left upper quadrant, and the left lower quadrant.
And she will describe if the sounds are hyperactive or hypoactive. And you will want to know, if you do not hear bowel sounds, how long do you have to listen to the abdomen before you make such a statement?
5 minutes.
1 minute?
The next thing I'm going to do is listen for your arteries, and I'm going to do this with the belt of my stethoscope, the small side. So we're going to listen to the right iliac, the right renal, the left renal, the left iliac, and the periumbilicus. All right, everything sounds good. Yay! No bruise. Okay, the next thing I'm going to do is check your pulses.
Okay.
And so I'm going to percuss. Okay, the last thing I'm going to do on your abdomen is palpate and percuss.
Okay.
So first, I'm going to palpate in each quadrant, and let me know if you feel any pain.
Okay.
I'm going to go light touch at first in all the quadrants. Did you have any pain?
No.
Okay, I'm going to go a little bit deeper. Let me know if you have any pain.
Okay.
Or if you're ticklish. Did you have any pain?
No.
Okay, good. Now I'm going to percuss.
Okay.
If she was to have pain, we would check for rebound tenderness. Rebound tenderness is found if they have pain. I don't know what I'm trying to say. If they have pain, you would do the rebound tenderness check, and you would check on the opposite side of the abdomen from where the pain is. So let's say she has pain on her right side. So I will go at a 90-degree angle, a quick up and down.
No, not like that.
I thought that's how you did it.
No, you like push down and then like up.
Yes.
Yeah. And then it would hurt.
Do you have pain?
No.
Okay, good. She doesn't have any pain. But if she did, it might be an indicator of appendicitis. Okay, now I'm going I'm sorry, I forgot. Now I'm going to percuss in each area, each quadrant of the abdomen in a zigzag formation. Normally you do 3 percussions in each quadrant.
And you will just go through this motion during your assessment, but you do not have to state what you hear under that percussion, because that's pretty much an advanced skill and takes a lot of learning. So I just want you to know how to do it. Okay, so that ends the abdominal exam, and now that she will switch to the peripheral vascular exam, which she can do with the patient lying down or sitting up. You can always ask your patient's preference if you like.
Would you like to sit back up, or would you like to keep lying
Oh yeah,
down?
let's sit up.
All
I'll
right.
just sit up like this.
Okay, perfect. Okay, so for this next part, I'm gonna palpate for your pulses.
Okay.
First, the radial pulses. I would grade them, and so these are +2, and they are equal bilaterally. Okay, and now I'm going to check your capillary refill by pressing down on each finger. If the patient was to have nail polish on, you would not press down over the nail bed, but instead right below on the skin. So capillary refill is normal, below 2 seconds. Okay, so now I'm going to feel for the pulses on your legs.
Okay.
The first one is the popliteal, and this is behind the knee. This one is difficult to find, but it's easier if you have them bend their knees and you press pretty hard against the upper calf right behind the kneecap. Okay, and now we're moving down. I'm going to move down first to the pulses on the feet. I'm going to take off your socks. I'm also going to note any kind of deformities or any kind of skin lesions or anything like that. I don't see any. So the first one's the Dorsalis Pedis. I'm again going to grade these, so +2, equal bilaterally. And now the posterior tibial, which is kind of behind the ankle bone. +2 bilaterally. Okay, and then I'm going to check for edema by pressing on her leg.
And if there were edema, she would then describe whether it was 1+, 2+, 3+, or 4+. You don't have to do that during this examination, but it's not a bad idea when you practice because it's going to help you on your exam. So as long as there is no edema, then you would state no edema. If there was, then you need to know how to grade it and describe what that grade means.
So I did observe +4 edema. Just kidding. No edema here. No edema.
If it was +4, she would be pretty debilitated.
Yeah!
And
Only kidding.
there would be absolutely no way that that skin, that indentation comes back to normal. But luckily, she truly does not have any edema.
No edema.
Okay. And
now the last thing is the capillary refills on the toes. And again, since her toenails are painted, I'm going to check right above on the skin.
excellent.
And I'm going to make sure and press each toe. I see good capillary refill below 2 seconds.
And when you're looking, anytime you're looking at the feet or you're doing looking at the toes, you also want to make sure you look at the skin and notice if there are any lesions or sores, because someone with either PAD or peripheral vascular disease may have, or diabetes, may have some poor healing lesions on their feet. And that concludes that exam. Good job.
Yay! Go nursing! Oh God.